Mumbai's famed health infrastructure is under tremendous stress, my friends. Once the home to many people, the private hospitals, state run institutions had been the place of choice for people coming from many states and cities across India and sometimes many other parts of the world. Now, just on April 13th, you found that the number of deaths in Mumbai have crossed 111 as a result of the coronavirus. The number of freshly admitted cases exceed 238 all in one day, and has created a tremendous scare at what's going on in Mumbai. Now, what's so terribly wrong in Mumbai that they are unable to control? Let's be fair at the first instance by saying that it's a densely populated city. The number of people staying in a square meter is very large, and therefore there is always the worry that social distancing is not possible quite as much in a city like Mumbai. That always works to its detriment, whether it's the pandemic time or even otherwise. Now, you find that the list of hospitals which have been downed by COVID-19 are some of the most prestigious hospitals in Mumbai. Bridge Candy, Khar Hinduja, Bhatia, Wokhad and Saifi. They all have had cases of the health workers themselves falling or testing positive. So they have had to shut down substantially. Yet, you realize that the most important hospital in this coronavirus fight is Kasturba Hospital. It does not have an intensive care unit, nor does it have a full-time senior intensivist. So this is really surprising. I mean, there's a major hospital which is to take care of coronavirus cases, does not have an ICU. It's no secret that coronavirus is especially dangerous for those with underlying health conditions like health ailments, diabetes and respiratory disorders, even asthma. Yet Kasturba was allowed to struggle for weeks before it started transferring critically ill patients to another hospital, the Seven Hills Hospital. That itself was almost a dead hospital. It had to be taken over to deal with this coronavirus pandemic. So rather difficult situation for Mumbai. In any event, Seven Hills has its own issues, and the hospital was shut down from the private after its private operator had walked out earlier. Anyway, now it was brought into the picture so that it could take some load away from Kasturba Hospital. While the effort to revive a hospital in record time is praiseworthy, the fact remains that Seven Hills still has only an 8-bed ICU. 8-bed ICU, that's all. And frantic attempts are being made to expand it to 30 beds. So 8 ICU beds is all that Seven Hills has, and there were some editorial concerns about the type of food being served to patients, etc. Anyway, BMC has now taken care of all that, which is good. And one realized that of the 11 COVID-19 deaths in Mumbai, 7 were in the 50 to 65 age, and all of them had comorbid conditions like hypertension, diabetes, heart disease and asthma. Most worryingly, all the 7 died within 2 days of being identified as COVID-19 positive, pointing to critical care gap that is costing Mumbai lives immensely. In fact, a 65-year-old woman brought to KEM hospital on April 12 died on Tuesday. She had severe breathing difficulty when she was brought in. And there was a 36-year-old male admitted to Rajawadi Hospital on April 12, died on Monday. So they are dying between 1 or 2 days. That's the sum and substance of what I was trying to say. He was also asked, Rajawadi Hospital does not have a chest physician and an intensivist on its panel. Rajawadi, in fact, is among the Mumbai's biggest hospitals in the eastern suburbs, as most of you all watching this video must be knowing. It can take 100 COVID-19 cases, which is pretty good. So at least it has got a substantial capacity, but it does not have a single ICU bed. So most people who come with those severe comorbid conditions such as heart issues, respiratory syndrome, then they need to be having a ventilator, they need to be in an ICU. None of these hospitals even has an ICU. In fact, looks like there's a complete lack of preparedness. It appears that the health authorities never even imagined or thought that they may have to ever deal with a pandemic of this proportion. That while the first case was detected on March 11, a month later, Mumbai still does not have a full-fledged COVID-19 hospital with dedicated ICU facilities. Not one, even till today. In fact, to properly treat its people, Mumbai needs more than 500 ICU beds right now. A big private hospital should come forward and declare itself as a COVID-19 facility. And now the questions are that ventilators, that there is a belief that, between all our COVID-19 designated centers, that there is a need of at least 51 ventilators, including 11 at Kasturba. That 87% of the COVID-19 deaths have had comorbid conditions and 7 to 8% had age-related factors. Intensivists from KEM, Nair and Sion Hospital are assisting doctors at Kasturba in the absence of hospital's own full-time intensivist. Can you imagine this? And they are scaling up the ICU beds capacity and asking private experts also to help them in assessing and determining how to treat critical care patients. This is when the Rome is burning, then now we are beginning to play the flute and trying to figure out what's going on. Well, anyway, the short sum and substance of this whole thing is that the city and the state needs to be more prepared to face many things. One is a pandemic; they have been completely unprepared. Another thing that they need to do is they need to make sure that they can face a terrorist attack in the future. They were very poor preparation last time around, and Mumbai had to suffer dramatically. 3 days almost was in a lockdown condition. So I think that the intelligence has to be there in Mumbai. But at the same time, I give all credit to Uddhav Thackeray and his son Aditya. They have really gone out of the blue, and they have really turned in a tremendous effort. In fact, the effort that they are putting in today is much, much beyond imagination. So all kudos to them for turning in a wonderful job. Uddhav Thackeray says that he has talked with the Prime Minister even regarding migrant laborers, and that was not well addressed. But that means he's putting in the effort, and it does appear. So I think all hats off, and anything I can do for the city, and anything we all can do as a contribution to Uddhav Thackeray, please just give us a call. We're just call away. In any event, please bear in mind that Mumbai still doesn't have a full-fledged COVID-19 facility, and that's why so many deaths. So whereas I have been focusing on much of the investment world, but Mumbai being the city in India where the entire epicenter of finance lies, I thought I should bring this to your attention. This also has repercussions on the world of finance. So please bear that into consideration. And while making your investments, these have indirect correlations. Happy investing. Take care. Bye-bye.